Next up is Ryan Vett with Anutra Medical.
Good morning. How's everyone this morning? You guys are quiet. How's everyone this morning? That's a little better. So I want you to think with me for just a minute. What is the one thing in the industry that has plagued the industry for centuries, pretty much since the industry has been developed, that plagues both the patient and the practitioner equally? What is that Achilles heel? I'll answer that for you. The local anesthetic. If you think about the local anesthetic, it is one of the things that patients fear most about going to the dentist. They hate that shot. In fact, in a recent survey done this year by PBS, there's three reasons why patients won't schedule their next appointment with your office. The first is the cost. The second is the pain of the needle. And the third is the time it takes to get numb without the dentist in the room, because often the dentist will leave the patient's side and walk and check hygiene. That's also one of the problems for dentists, because once you anesthetize someone, you hope you hit that block or you hope you get them numb. But when you leave and go check hygiene and you come back 15 minutes later and that patient's not numb, what happens? Your whole schedule for the entire day is thrown off. And so now you have to figure out, okay, how can I maneuver the other patients? And then that emergency patient comes in. And so you have an emergency patient and a patient that's off schedule. Before you know it, your whole day is thrown to the wayside, all because of local anesthetic. Have you ever thought about this? So when a business person goes and schedules a meeting, they schedule 3 different meetings: marketing, HR, and finance, right? And they'll start with the marketing, go to that meeting, they'll go to the HR meeting. You would never see someone run to marketing, then HR, then finance for 5 minutes and switch rooms, switch rooms, switch rooms. The only reason that dentistry does that is because of the inadequacies of local anesthetic. So local anesthetics haven't been a problem recently. In fact, they've been a problem since pretty much dentistry came around. If you wanted to get numb early on, you had to go get whiskey. So whiskey might be all right and give you a buzz, but that's not going to anesthetize the area that you're working on. There's obviously some inadequacies there. So they moved to something that they thought was better. Dr. Carl Collar up here on the screen, he brought cocaine to dentistry. He actually started with cocaine as a topical for eye surgery and ophthalmology. But what he found out, his good friend Sigmund Freud, this is a true story, it explains a lot about Sigmund Freud. His good friend Sigmund Freud figured out that you can use cocaine for nerve blocks and infiltrations. Now that explains why Sigmund Freud was the way he was. He was trying cocaine. So they used that for about 30 years, but they found out that the properties in cocaine were extremely addictive and that caused serious issues. And that's when, in the late 1800s, early 1900s, Novocaine was developed by Dr. Alfred Einhorn. So Novocaine is what we usually call our local anesthetic, whether or not we're actually using Novocaine. And most patients, as made famous by a lot of comedy sketches in the mid-30s and 40s, still call their local anesthetic Novocaine. Because of the high level of allergies and some of the complications that came with the drug Novocaine, they came with lidocaine. Lidocaine is the most universally used drug across the globe in all medical verticals, obviously including dentistry. But here's a fun fact for you today. Lidocaine is actually not a liquid. Lidocaine is a powder. So in order for it to become a liquid, just like any powder, you've got to dissolve it into acid. And in this case, we're dissolving it into hydrochloric acid. So if you've ever gone on YouTube and you've watched kids in their science lab dissolve their house keys or tinfoil or something like that, that's being dissolved in hydrochloric acid. It's extremely acidic. So most people think that when they're getting the shot, they fear the needle. But the true story is that most people, after you put your topical on, they're not even fearing the needle at all. So what I want to talk to you today about is a local anesthetic that is going to be almost instant onset. So as soon as you give the injection, you can go to work immediately. The patient's not going to feel that burning, stinging sensation. It acts as a local, also as a topical, and those hard to numb patients will also get numb the first time. And here's what it is. It's called buffering. So buffering is a science that's been around in chemistry for hundreds of years. It's been used widely in medicine for 50 to 60 years. What I've put up there for you is a half of a lemon. It's representing lemon juice. That's a 3.9 pH. Lemon juice is pretty acidic. Now imagine that lidocaine is even more acidic than lemon juice. So what you're doing is you're injecting something more acidic than lemon juice into your patient every single time they get a shot. That's where that burning, stinging sensation comes from. Part of the issue is, as you see, our body's at about a 7.4 pH. Part of the issue is that our bodies, some people's bodies just can't process that. So that patient that doesn't get numb, that messes up your whole workflow throughout your day, that's because they have what's called a diminished buffering capacity. Well, our founder, Dr. Dan Davidian, is a practicing sedation dentist in Raleigh. And he is one of the dentists, as a sedation dentist, that sees all of those patients who either fear the dentist or have a problem getting numb the first time. And so Dr. Davidian grew up in a very medical household. His father was a medical anesthesiologist, his brother a dental anesthesiologist, and he's a sedation dentist, among with some other medical professions throughout their family. And so Dr. Davidian often jokes that his father would ask him at dinner time about how they got people numb in dental school, as Dr. Davidian was going through dental school. And he would ask, why don't dentists buffer? And Dr. Davidian would go in and say, well, dentists are the only people that have those little tiny cartridges still, and they use those metal syringes, and you have to put a little bit out, and you have to put some sodium bicarbonate in. Long story short, the science was next to impossible for dentistry, until now, when Dr. Dan Davidian created the Anutra local anesthetic delivery system. So the shortcomings that plagued all of the dental industry for so long, the patients not getting numb right away, that pain, that fear, and the ability to only give 1.8 cc's at a time, Dr. Davidian figured out a way to do buffering more simply. So he brought buffering to dental, and what you can see here, this is our dispenser, and that is what holds the anesthetic. The syringe is what you pull the anesthetic into, and I'll talk about that in just a minute, and that's how you use the system. So the three reasons why you'd use buffering in your practice. The first of which is it's predictable. So how many of you in the last 2 or 3 weeks, raise your hand, have had that patient that you've wanted to get numb and you injected, and a couple of minutes later you came back to the office and they still weren't numb? How many of you have had a hard to numb patient in the last couple of weeks? A couple hands? Yeah. It's a pain, and it messes up your whole day. You miss your dinner, you miss your lunch, and everyone gets a little bit grumpier in the office. So what this is going to do in those hard to numb patients, especially those patients that have a diminished buffering capacity, like diabetic patients, patients with fibromyalgia, chronic pain, they will get numb 95% of the time the first time. Right now they only have about a 30 to 40% chance of getting numb the first time. So this is going to increase the predictability, which is going to ultimately help your workflow. But the thing that's going to help your workflow the most is the efficiency piece. So you can now inject and then stay with your patient and go to work immediately. You don't have to leave the room and go check hygiene and then come back and wonder if they're numb. In 2 minutes or less on a block, and about a minute or less on an infiltration, your patient will reach pulpal anesthesia, meaning you can drill and they're not going to feel that. So in a recent study done, we saved an average of 17 minutes per patient. The average doctor just in this study saw 6 patients a day. So 17 minutes a patient, 6 patients a day is about 2 hours a day of chair time that we were saving. You all know how important that chair time is in your office. And if you stay with your patient, that's another 2 hours we can add back into your valuable schedule and help your workflow. The final thing that you're going to find with buffered anesthetic is the reduced patient pain. So that burning, stinging sensation from the anesthetic that makes people feel that pain, they're not going to feel that anymore because it's going to be pH neutral. So that means when they get the injection, the number one thing that we hear from patients is, I didn't even know you gave me a shot. Imagine if your patient said that to you. But the other benefit of buffering, when you mix the buffering solution with the lidocaine, what happens is you get a topical. And all you have to do is dry the mucosa, put a drop or two on the mucosa, wait about 10 seconds and inject right through there. So you're not coming in and out of the mouth multiple times. I'm going to skip that due to time, but I do want to show you the Anutra syringe. So the Anutra feedback aspiration syringe is the first and only FDA-approved, this is going to be a mouthful, first and only FDA-approved one-handed aspiration syringe, multiple doses, that's fully disposable. What does that mean to you? So what that means to you is right now you're confined to the 1.8 cc carpule. That's all you've got. If you're working with a ped patient, you might be giving a quarter carpule and wasting the rest. If you have a big case and you need multiple injections, you're pulling that whole syringe out of the mouth, creating anxiety when you're shucking that carpule and hearing the glass and metal clink and then going back into the mouth. With our multi-dose syringe, it's the same exact size as your metal dental syringe, but holds 3 times the amount or the volume. So now you can give multiple injections without having to come out of the mouth. It avoids needle stick, and it follows the medical model, so it's luer lock, meaning there's more needle tips available to you in this syringe than there are in any dental syringe that you have. This is the way that dentistry is going, and the syringe is sold by itself in addition to coming complementary with the system. It's definitely changing the way dentists practice. So I highly encourage you to stop by our booth. It's 2325, and look forward to helping you learn more about the science, learning how you can improve workflow, you can stay with your patient, and help reduce your patient's pain. Thank you.